Good morning, everyone. This is Hope Hempstone from USAID Washington, and I am delighted to welcome you to this morning's webinar on increasing coordinated investment in social and behavior change for family planning. By way of background, the last 5 years have really seen renewed energy around the need to prioritize family planning and national health strategies and advocate for increased investment. While we've seen lots of great progress against those objectives, thanks largely to the leadership of FP 2020, we still see a lack of coordination around social and behavior change, or SBC, and this has resulted in duplication of effort in some areas and critical gaps in others. Breakthrough Action, which is USAID's flagship SBC project, has worked with a wide range of donors, coordinating mechanisms, and implementing partners over the last 2 years to develop and validate a shared agenda for SBC and family planning, with the aim of highlighting and addressing some of these areas of duplication and need. That agenda, which is available on the Breakthrough Action website, and I believe will also be posted in the chat box for today's webinar, outlines 5 priority areas for enhanced coordination and investment in SBC and family planning. These are improving SBC in the context of health service delivery, supporting social change for family planning, understanding and meeting the needs of young people, increasing coordinated investment in SBC for family planning, and focusing on Francophone West Africa, or the countries of the Ouagadougou Partnership. Over the next few months, Breakthrough Action will be hosting a series of webinars to continue the discussion around each of these priority areas. Each of these webinars is going to be recorded and will be posted on the Breakthrough Action website for those who cannot make the webinars themselves. This first webinar, as you know, is focusing sort of on the first step, the fundamentals, which is increasing coordinated investment in SBC for family planning. We are going to be hearing from 5 speakers. First off, Michelle Weinberger from Avenir Health will be speaking on behalf of Breakthrough Research, which is Breakthrough Action's sister project. She will be telling us a little bit about some really groundbreaking work that Breakthrough Research has done developing a business case for SBC and family planning and beginning to sort of articulate the return on investment for this type of programming. We'll then hear from Uttara Bharath Kumar of Breakthrough Action, who will introduce us to a message framework that Breakthrough Action developed, which provides guidance on how best to communicate with stakeholders who may be unaware or skeptical of the benefits of SBC. We'll then hear from Sohail Aga and Perry Sutton from the Bill and Melinda Gates Foundation, who will talk about their efforts around donor coordination in SBC. Sohail will be speaking about donor coordination efforts sort of generally at the global level, and then Perry will talk us through an example that is specific to the Ouagadougou Partnership countries. Finally, we'll hear from Pranab Rajbandari from Breakthrough Action's country program in Nepal, who will be telling us about an intervention that they have designed and implemented called the SBC Palika package, which aims to strengthen local level decision-making and investment around SBC for health. We will have time for Q&A at the end of the presentations. Please add your questions to the chat box at any time, and we will be collecting them and sharing them with the speakers after the presentations are finished. So with that, I will hand over to our first speaker, Michelle, who can kick us off with some discussion of the SBC business case. Here you go, Michelle.
Great, thank you, Hope. And so as Hope said, I'm gonna talk about some work that Breakthrough Research has been doing over the past couple of years to develop a business case for investing in SBC for family planning. So we don't have time today to go through all of the details of the business case. So I'm just going to give a very high level overview of some of the highlights around what we found about the effectiveness of SBC, the cost of SBC, and then bringing those two pieces together to examine this idea of cost effectiveness. The full document is available on the Breakthrough Action and Research website at the link at the bottom, and I'd encourage you to have a look at more. So in terms of effectiveness, we looked at SBC effectiveness in a couple different ways for this work. In all, we leveraged 130 different studies to give us evidence about the effectiveness of different pathways of SBC interventions. We looked at an indirect pathway, as you see on this top part of the diagram, where we looked at the role of SBC interventions in shifting intermediate outcomes. So these are things like improved communication with partners or attitudes about contraception. And then we looked at how those intermediate outcomes relate to modern contraceptive use. We also took a more direct approach, as you see at the bottom, looking at evidence that directly linked SBC interventions to modern contraceptive use. And we did this to really make sure that we weren't missing anything by going through these series of different intermediate outcomes. As you can see, we leveraged a range of existing resources, including the HC3 database, which was compiled by Breakthrough Action's predecessor project, as well as work that was done under the Track 20 project on the FP goals model. So what did we find? We found that SBC was effective in improving intermediate outcomes. There's a lot going on in this diagram, so I'm just going to walk you through it quickly. So first, let's start with the circles on the left-hand side. So these are the three types of SBC interventions that we looked at. So first, we have mass media, which includes TV, radio, digital, and social media. Next, we have interpersonal communication, or IPC, which includes both group and individual communication. And then we have what we're calling packages, which are mixes of different types of SBC interventions. So this could be things like community mobilization that included some mass media or IPC elements within it. We found is that a lot of SBC interventions end up in this packages piece because we know that often the big strategy is to employ multiple different avenues when working on SBC. So next, we can look at the lines connecting these three different SBC interventions to the intermediate outcomes in the middle. And here the thickness of the line tells us about the amount of impact as measured by an odds ratio, which tells us about how exposure to the intervention leads to a change in the intermediate outcome. So the thicker the line, the higher the impact. So if we zoom in here just to look at packages to see this a bit more clearly, we see that packages has fairly thick lines connecting to all the different intermediate outcomes, meaning it had a positive effect on increasing all of these. And we see that the thickest line is between packages and communicating with partners about family planning, meaning that was the strongest relationship that we found in the data. So now we can look at the second part of this pathway, which is how these intermediate outcomes affect modern contraceptive use. And again, we found that there is positive relationships, so that these intermediate outcomes lead to higher levels of contraceptive use. Though as you can see by the variation in the thickness of these lines, that some pathways seem to have a stronger influence than others. One note is that these odds ratios or impact factors are only part of what determines the impact. There's lots of other important things at play to consider. For example, how much an intervention can be scaled up, who that intervention can reach, and the existing context. So what are the existing levels of contraceptive use and what are the existing norms, approvals, and attitudes within the country? So that was a very quick overview of impact, and now we'll take a quick look at costs. We were able to leverage more than 50 studies to go into this analysis of the cost of SBC. While there are still gaps, I think this was a lot more than people initially expected. So I think there's also a positive message in there that maybe we have more out there than we thought we did that we're able to utilize. But we know that there are gaps, and so we know work being done by Breakthrough Action, Breakthrough Research, and other partners on costing are helping to fill these gaps so we can get a better sense of what SBC costs. As you can see from this graph, there's wide variation in the unit costs across these different types of SBC interventions. The one thing that's important to note is that our units are a bit different. So for mass media, we're looking per person exposed, while for IPC and packages, we're looking at per person participating. So they're not quite directly comparable. The We also found that some of the newer forms of SBC, especially things like social and digital media, we don't have a great sense of the cost because there's just not as much documentation of those approaches, but hope in the future that we'll be able to get a better understanding of the cost of these type of SBC approaches. So then finally, we're interested in looking at cost effectiveness as a way to make this case for investments in SBC for family planning. And so to do this, we need to bring together the two pieces that we've looked at. And the way that we did this was through modeling sort of hypothetical scenarios of cost effectiveness in two countries. So we looked at scaling SBC interventions up over the coming 5 years in these countries aligned to their national plans and strategies. We then utilized those odds ratios or impact factors I showed earlier with additional country data to model out what we thought that scale up would result in terms of gains in contraceptive use. Gains in contraceptive use were able to be converted into additional users, pregnancies averted, and ultimately disability life years or DALYs saved. Then we took the unit costs that we looked at on the previous slide and we applied them to that same scale up scenario to estimate the cost of the SBC interventions. And we also look at the cost of the direct service delivery of reaching those additional users. We're then able to compare these two to get a cost per DALY saved. And we use this as our incremental cost effectiveness ratio or ICER. And this gives us something that we can compare to other interventions and also benchmark to get an understanding of how cost effective these SBC interventions are. Before we look at cost effectiveness, let's just take a look at the impact results that we found. So our modeling took place in Zambia and Guinea. These two countries were selected in consultation with colleagues at USAID and Breakthrough Action to align to other efforts going on around advocacy for SBC in these countries. We found large impacts with gains in MCPR between 3 and 5 percentage points over the 5 years, and that those gains then translated into additional users reached, pregnancies averted, and DALYs saved. In the final row of this table, you can see our estimate of how much that scale up would cost. And then by comparing those last two numbers, we get to our ICER, our incremental cost effectiveness ratio of our cost per DALY. In Zambia, we found about $1,000 per DALY saved, while in Guinea, this amount was about $440 per DALY saved. The WHO says that anything that falls below 1 times the GDP per capita is considered highly cost effective. So those benchmarks are shown here in the green lines. And what we found was that in both countries, that the scenarios that were scaled up in our modeling would result in a highly cost effective result. And we were able not just to look at cost effectiveness, but also to look at returns on investments. And we found that for every dollar invested in SBC, between $2 and $6 would be saved when you looked at both the direct healthcare savings, as well as the longer term productivity losses saved through that work. So we see some great results that can help advocates in making the case for SBC. Which has led to a call for action within the business case. And this call for action is really for advocates, for policymakers, for implementers, and for researchers, with a call to utilize these results to advocate for more investment and make those investments, and then also a call to generate more evidence to fill the gaps that we still have as we look forward. And finally, just a reminder that the full business case is available online with a lot more information than I was able to cover in these few minutes today. We also have some 2-page fact sheets summarizing the results in Guinea and Zambia. And as we look to the coming year, we have some new products coming that we hope will help continue to get this work used more, including an interactive infographic, doing some modeling in additional countries, and making that underlying cost data available through the unit cost study repository. We're also expanding the work that we've done on family planning into malaria to develop a similar business case for SBC for malaria.
Thank you, Michelle. Uttara, over to you.
Thank you, Hope. I hope everyone can hear me. Good morning, everybody. Good afternoon or good evening, depending on where you are. I'm just going to give a quick overview of the influence strategy, but to begin that, wanted to give a little context before we got started. Okay, so I wanted to start with a slightly bigger picture to give some context to the message framework and start with why and how the message framework was developed. We interviewed under Breakthrough Action, the first year of the program, a number of stakeholders in the field of SBC, working in family planning, to help us align our efforts to see how SBC gets financial and programmatic support, and asked them in interviews what their perception was, and given that there's how do they feel about SBC in family planning? What are some of the impressions they have? And based on that, we found a number of interesting things that came out of it. We heard in our interviews there's an increased understanding and interest in SBC, but there's also a number of challenges. First, there was a limited understanding of what SBC really is, and then a sort of limited investment because of some of those challenges and a lack of coordination. So essentially, we wanted to focus an influence strategy on these three areas, which was to raise the holistic understanding of SBC, so the community as a whole sees SBC as a discipline that could be applied across different programs. And the second was increasing investment in SBC so programs can receive the full support that they need and deserve. And thirdly, coordinated approach among stakeholders. And because these changes will allow us to work more effectively in a field and ultimately get better results to our beneficiaries. And we understand that the actors involved in this, the core of it is the government, the country government, and around that, the folks who work with them, including the funding agencies, bilaterals, multilaterals, donor community, private foundations, and even stretching across global networks like FP 2020, the Ouagadougou Partnership, GFF, etc. And if we can align all of these and give them a better, more convincing argument as to why SBC investment support is important, that would be good. So in a sense, we're looking at our these stakeholders as an audience to communicate to, and to understand them better, understand what some of their barriers are to doing that. So the donors are all the way from, unaware, skeptical, restricted, and under-resourced. So if people you've got a range of issues, like if you stock it, they will come. So people, services must first be improved before we can invest in SBC, or they're skeptical, saying things like, I haven't seen evidence that SBC really works. It doesn't have the same return on investment. And fortunately, the case study that Michelle presented earlier is going to make some great headway in moving people along on that issue. Or they're restricted, saying, my board just wants to know how many condoms we purchased or how many commodities we've been able to stock. So they don't have the freedom to invest in SBC. They're restricted in the way they can spend their resources. Or the under-resourced buyer, saying we have to make sure our implementing partners include SBC, but we really can't verify the strengths of these programs. So they don't have the capacity to do more. And the country may also have implementation barriers, short-term focus, or social norms, especially in the example that I'm going to share with you. We can't address unmarried youth because that's against our culture. Or limited expertise. We include SBC, for instance, but here's the poster. This is IEC. That sort of checks the box. So understanding what quality SBC is a challenge. Next slide, please. So this move to a global influence strategy, from that we wanted to take it from the global influence strategy to what we wanted to call a message framework. I'll skip this slide, Marcella, just because I think we're a little short on time, and go to the message framework. So what emerged from this is, how can we help countries assess where their donors and their partners are on this, these different concerns that are inhibiting them from really including SBC as a key issue, key element in their family planning programs. Next slide, please. So we need to know where the stakeholder is, and we've talked about that. So we looked at three sort of approaches, messaging pillars for investment in SBC for family planning. The first one was SBC approaches complement service delivery. So that's a powerful argument. And the second one is that SBC is rooted in global evidence and best practices. And the third one talks about how SBC demonstrates a high return on investment, both short-term and long-term. So the complementing service delivery, it includes a range of approaches and that can be applied across family planning, not just demand. So including things like the circle of care, where you're starting from before, during, and after, informed by the local needs necessary for achieving the community's priorities. To say, if you invest in SBC, it can help you achieve that last mile in addition to service delivery, and bring people to the services and help them continue use. The second pillar, SBC being rooted in global evidence, looking at successful interventions in different countries, bringing in examples, showing how family planning has worked in investment SBC in family planning has worked in different countries. The Nuri example was used when we were talking to different programs about the ideational factors that contribute to increased family planning. So these kinds of cases and examples from different parts of the world make a powerful case. And the third one, of course, is something like the business case, which Michelle shared. People need to see, if I put this money in, is it better invest in a good investment for me instead of like investing it just in commodities. Next slide, please. So unaware stakeholders, skeptical stakeholders, restricted stakeholders, and under-resourced stakeholders. Those are the sort of four pillars we wanted to look at and really examine each country to examine where a majority of their participants are, their donors and players are. Next, please. So this is the framework, and after this I'm going to give an example from Zambia of how Zambia used the framework. The idea of developing this was different countries could use this as a template, plug in their issues after they figure out where their stakeholders are, and then work through the message. So if you look at the framework, it talks about the stakeholder type, the organization, what is their role, what's their current SBC view, what are some of the barriers and drivers of the specific barriers and drivers for this audience, and then who's the segment of the audience, not just this individual stakeholder, but which audience segment do they represent? What are some of their goals? If you want this person to engage in SBC, what's in it for them? Sort of looking at them to see, if they put this effort in, what will they get out of it? Looking at previous conversations, information, confidential interviews, etc. What can we bring to the table to really help understand how to convince folks? And then choosing which one, like either the service delivery, global evidence, or the business case, which approach do we want to take? And lastly, looking at applied message framework, prioritizing support points. How can we, if you invest in SBC, you will benefit by, and then you're looking at different ways in which they can benefit. So we want to also enter, second supporting point or a third supporting point. So give them different options of different reasons why they should invest. And finally, looking at key additional evidence or supporting points like anecdotes or people's testimonials from people, data, and so on that can support this ask. Finally, the most important thing is, what's the ask? What do we want them to do? And what will you ask the stakeholder to do? So being very clear about that. Sometimes what happens is we end up giving people a lot of information, the stakeholders, but not being very clear about what is the one specific thing or two specific things we'd like them to do. And it can't be something vague as like, support SBC, how? So that's sort of where the framework wants to end, with a very specific ask. Next slide, please. So this is the last slide, and I'm going to walk through this example of Zambia and how we use this framework in Zambia to think about how can we increase their investment in SBC. Examining where things were, looking at the National Family Planning Technical Working Group as the sort of the audience that we wanted to focus on, because that had all of the players, all of the stakeholders there represented. we realized that in the costed implementation plans, SBC activities appeared, but were not articulated in a detailed way, nor did they get funded each year. So they would just be repeated and then nothing was really getting support, even though people sort of kind of felt SBC was important, but then had all these concerns. They were skeptical. Should we be investing in this, and will it be done well? Because I don't think there'd been an example of it being done well enough to show them that, effective results can happen. So looking at teenage pregnancy and adolescent pregnancy and pregnancy prevention, which is a huge priority for the Zambian government and the family planning technical group, that was a piece around which we focused the attention, saying in 7 years of working on the SIP, we've got results from 0 to say 80%, but why are we not going to the full extent that we'd hoped? Maybe that difference is SBC. And bringing in evidence from different countries of how things could work. A presentation was made by Breakthrough Action to the Family Planning Technical Working Group's advocacy subcommittee, and they took it to the main working group. And people felt quite moved by the idea, and they felt, okay, maybe this is an important thing we should invest in, and let's constitute a SBC subcommittee to the technical group, working group, so they can work on what would be the most strategic, focused SBC activities we should include in the costed implementation plan. And we can try to see how we can support it. So that was a huge step. The ask was, will you consider including SBC activities and supporting them in the 2020 SIP to complement your service side investments? And that was a clear ask. So the skepticism of the audience was recognized, and because they doubted the effectiveness of SBC, its ability to generate quick and reportable achievements, and without convincing evidence that SBC had been effective globally, so it would help decrease unplanned pregnancies among adolescents. They were unlikely to support it. So they needed proof, persuasive evidence that SBC activities are effective in increasing use of FP, and to be convinced of the need to include it strategically in the costed implementation plan. So the goal was for them to include these activities and focus on adolescents and not make it about just sort of generic messages and posters, but really look at the adolescents as an audience. Where can we reach them? Who are their influencers, and so on. So a message framework has been developed to present to the technical working group. And in fact, that's going to happen next week for them to consider for inclusion. So gathering of the family planning technical working group, they were keen to meet the FP 2020 goals, but were short on targets. And they were looking for ways to understand why they were falling short, and open to hearing about how SBC could play a role, especially with adolescent pregnancies. And the supporting points that were shared was, investing in SBC can help increase your program impact. And there's evidence from last 30 years to support this. I think people had not seen it laid out that way. To really look at different examples of how family planning programs had worked. There's also evidence from various countries that support cost effectiveness and the impact of SBC. So the business case studies came out in great time to be able to share that with them. And a small investment in SBC can further strengthen and complement service delivery. That was also a very convincing argument. So we also looked at key additional evidence, which was the SBC evidence database, which we can share a link for, breakthrough research business case studies. And we also looked at the animated film from Nigeria that Nuri had produced, and that was actually, we'll share a link for that as well, was very well received. And when skeptical questions came up, like, why should we promote family planning for adolescents? We should be focusing on abstinence. So there was a lot of resistance in the community about why should it be promotion of methods instead of abstinence. We created a small animated video through Breakthrough Action to try and counter those arguments and bring about understanding that that is one of the options, and young people need to make informed choices. So we will share the links for both the animated films and the family planning SBC evidence database. But hopefully next week we'll have some evidence that this framework has actually had some practical application in the field. So this is one of the cases, and I wanted to share that example.
Great. Thank you, Uttara, and thank you so much for walking us through that example from Zambia. That was really helpful. Without further ado, I will hand over to Sohail Aga and Perry Sutton from the Bill and Melinda Gates Foundation.
Hi, folks. I hope you can hear me clearly. I'm going to do the first part of this presentation, talking more about the coordination of SPC investments. In 2017, the Bill and Melinda Gates Foundation did a landscaping study of demand and social and behavior change, and refreshed our approach with 3 key priorities. Improve funders' fragmented and uncoordinated investments and purchasing behaviors. Build implementers' capacity to incorporate adaptive learning and program design in execution. Strengthen demand and SBC learning networks and evidence generation in low and middle income countries. So these were our 3 priorities. In December 2018, in collaboration with USAID and the Children's Investment Fund Foundation, the Bill and Melinda Gates Foundation hosted a donor meeting in Washington, DC, to explore how we might better coordinate at the global and priority geography level. Public and private donors, multilaterals, and a global family planning partnership were included in this meeting. The meeting objectives were to share each donor's key SPC priority and their motivations for improved coordination, to share out investment and partner mapping, to discuss successes and challenges in donor collaboration in order to identify gaps, to identify existing investments and co-investments, learning agendas, and global public goods that donors are already making in order to improve demand-side funding, and finally, to identify, monitor, and evaluate priorities. The key outcomes of that December meeting were donors agreed to the following: to participate in quarterly coordination meetings, to continue to learn about each other's priorities, and to learn from existing co-investments and platforms, to continue to build the investment database we prepared in advance of the meeting. This database will provide a clear picture of donor demand and SPC priorities to donors, and it will be initiated in 6 priority geographies, including Nigeria, Ethiopia, and India, and 3 other priority geographies. This is a database that we are currently working on and has over 300 investments which have a focus on SPC across 8 donors and 3 multilaterals. And I think this will be an excellent way of learning about each other's priorities and planning work together. Other areas that rose to the top during our meeting were measuring cost effectiveness, defining what level of proof is needed to guide programmatic decisions by programmers. In other words, looking for trends with lighter touch methods that can be more timely than rigorous evaluations. We also talked about building implementer research and institutional capacity in low and middle income countries and low income countries. We talked about a rights-based approach that recognizes social norms are as important. Collaboration on advocacy to inform policy making and to share findings and learnings back to countries were considered important. And finally, coordinating better at the country level and ensuring that governments are engaged. One example of shared learning which has enhanced donor investment in this is the Social Norms Learning Collaborative. As social and gender norms are a critical driver of family planning behaviors, programs must strive to be more gender transformative. Yet social and gender transformative interventions can be challenging to design, deliver, and measure. Many donors, governments, and partners recognize the need to tackle this challenge and uncover new and effective approaches to implement normative interventions. Given this interest, efforts are being made through the Learning Collaborative to advance social norms, supported by the Gates Foundation and USAID, to foster synergies and collaboration amongst donors, implementers, and researchers. Recent convenings of this group, of this community of practice, have highlighted the need for greater attention to the ethical considerations of social norm change, to development of standardized measurement scales and tools, and to making resources and guidance on how to design, measure, and scale up normative change simpler and to make it easier to implement. So these are some of this is an example of a collaboration between donors. There are several others, and these are some of the things we discussed. And we're looking forward to increasing our collaboration through this donor coordination group to basically improve the 3 areas that we found through our landscaping to be weak, which was lack of coordination, the need to build implementer capacity and to incorporate adaptive learning, and to strengthen demand and NSBC learning networks in order to improve the quality of the work in the field. Thank you.
Thank you, Sohail. And now I'm just going to talk a little bit about the Ouagadougou Partnership. I know there are others on the line who are members. Let's see here. So the Ouagadougou Partnership was established in 2010 to respond to an urgent need for action on family planning in Francophone West Africa. There's recognition that this region lags behind the rest of the continent and the world on indicators of maternal and child health, including family planning, and that we needed to work differently to create change and ensure that the region doesn't continue to be left behind. Next slide. And you can see here, these are the 9 Francophone West African countries. That's the focus geography of the Ouagadougou Partnership and the logos of the current members. And the group has steadily grown year on year. I think the most important point here is that national plans are central organizing documents. So this group of partners together strive to ensure that those plans are high enough quality and prompt the discussions among countries, donors, and implementing partners that are necessary for improved coordination. Next slide. We've achieved success with unprecedented change in terms of contraceptive prevalence rates. And more importantly, we've created a family planning movement in this region. I think some of the things I've highlighted here are the success factors, and I'll just highlight a few. One, there's a regional goal that's been established in addition to individual country goals. And that regional goal draws the attention at a global level that the individual countries weren't able to necessarily have previously for various factors. One just being the relatively small size of these countries. I think data visibility and progress monitoring also fosters some healthy competition, but more importantly, some mutual accountability for performance among all actors in this space, and it pushes us to work together more effectively. So there's a real incentive that's visible, it's recognized compared to other regions and countries. Peers across countries are sharing experience and information, promoting effective interventions and sparking new ideas. And this is just, it's so exciting to see where, you know, there's a real sense of kind of shared resources. If one country benefits from a regional program that another country does not, I've seen donors come together to strive to find other mechanisms and ways to replicate the successes that one country, which, you know, has some specific TA or funding support in other places. Next slide. And here, this slide just shows some of the mechanisms that we have to improve our coordination as members. We have a coordination unit. I think, you know, most importantly, we know one another. And the group evolves over time. It requires kind of consistent interaction, whether it be remote, by phone, on webinars such as this, at in-person meetings, through social media. I think the Ouagadougou partnership has been likened to a big family. It really feels that way, and boy, it's easier to coordinate when you have that kind of connection with the other actors in your space. We're constantly evolving and trying new things that better respond to data and feedback from members. And and a great example of this, SBC was the theme of our 2019 annual meeting. And in fact, we had the opportunity together as a full membership to review and discuss the analysis that Michelle presented earlier. That's really just calling out, you know, in your plans, we're going to make limited progress in some of our member countries if more is not done on SBC specifically. And then, you know, 3 days of meetings to look at what's being done, look at, you know, discuss some of the best practices, exchange and begin, you know, planning for how we can work better, uncover new mechanisms, just really push one another to unlock the impact that's possible through stronger coordination, and specifically now within the Ouagadougou partnership in this particular technical area. So I'll leave it at that.
Thanks, Perry and Sohail. Pranab, over to you.
Thank you. Hi, everyone. So I'm taking you across the world, depending on where you are to Nepal. So even in Nepal, to more of a local level, micro level, looking at how do you increase local level investment in SPC, how we did that. Just to provide a context, so Breakthrough Action in Nepal has been working on SPC system strengthening in Nepal for the last 2 years, and we have been working to develop a prototype, which is the SPC Palika package. Palika in Nepali meaning municipality, so it's a local SPC municipality package. We have come up with that now. So I'll take you through that in terms of how that came about and how were we able to get the local level investment in SPC in Nepal. Next slide, please. So I wanted to start with a quote from Jane Goodall. I think everyone know who Jane is. She kind of talked about, I think it's most about interspecies understanding about, if you understand, we care, and only if we care, we will help. So I think that applies for SPC as well for us. So next slide, please. So the Palika package, which I just mentioned, has helped us strengthen local level decision making around SPC for health. Next slide, please. So what has happened over the last year is we have worked in 4 focal municipalities in Nepal, and for the first time ever, they allocated local funds, local resources, their resources, about $35,000 US, which is a huge amount of money in Nepal, especially in the local level, by themselves once they understood the value of social behavior change. And next slide, please. In terms of Nepal, so Nepal has been undergoing it's changing its governing structure from a more of a centralized structure to a federal structure. So now we have the federal level of government, then the provincial level, which you can see on the little map that was on my slide. We have 7 different provinces, and you can, I don't know if you can read that, but we're still in the process of naming the provinces. So out of the 7 provinces, there's still 2 of them that don't have names. They're still called province 1 and 2, while the rest have now being named. Then we have municipalities. There are 753 municipalities across Nepal. So a lot of municipalities spreading across Nepal. And in terms of authority and resources, the change now that is taking place is now the local level municipalities, the local level government has the resources. and the authority to design and define where they would like to spend that money. So having said that, the question was, how do you strengthen SPC system? In terms of context, what I'd like to talk about is when we first went there. I mean, I've been working SPC for 15, 20 years now. The priority is not SPC. When you talk about development, the development is hardware, infrastructure, roads, buildings. I mean, that's on a high priority list. So health is a bit down the line, but even in health, it's more of medicines, buildings, services, and SPC is not really well understood, especially in Nepal. It's not a priority. And so what we also found out is in terms of using, working on SPC based on evidence, not a practice. And definitely on the coordination part, I think the other speakers like Uttara also mentioned this, is weak. So I mean, in this context, how do you move things and get people to start and think about SBC and pay attention and put funding on that, local funding on that. Next slide, please. So as you can see in this little model, you building capacity and changing the system depends on, working at the individual level, working at the organizational level, and at the system level. So even within that, I like to kind of focus on, for example, at the individual level. What we did do is foster SPC leadership at the individual level. So they got an understanding, saw the value in that, and took the leadership. They became advocates for SPC. In terms of at the organization level, looking at data and working based off of evidence when they design and plan activities. And then critically, they understand that the critical nature of SPC for the health system. They understood that, and they put money towards that, right? So that's how it progressed. Next slide, please. So this is a snapshot, a cover page of the prototype I was talking about, the SPC Palika package, the SPC municipality package, which is in print now, which is being shared with our wider audience next week. It's pretty exciting because this has been a culmination of a year-long effort working with the end users across our municipalities and working very closely with them in designing and coming up with this project, this prototype. Next, please. So it's been, as you can see, we followed the human-centered design. It was more of a human-centered design informed process where we're working very, very closely with the end users to assess what the situation is, then based on the assessment, providing training, then working very closely with them in designing, collaborating with them. So more of a CLA, collaborative learning and adapting. So they learned technically what SPC is. We learned how things were, what could be done, how do you refine things, how do you come up with a package. Then over a period of about 10, 11 months, we finally came up with a consolidated package, which is again reviewed, refined, tested, used at the local level. And that's how we have come up with the package. Next, please. So what does it have? It has a step-by-step guidance for SPC programming in terms of looking at effective planning, implementation, advocacy. I think a lot of our speakers talked about advocacy, which is very, very important, and monitoring of SPC programs in terms of looking at data, using that. And again, to remind everyone that, I mean, this was very, very basic because that's what the need of the audience was in terms of what was needed at the local level. Next, please. So what we did was we built it around the existing local government system. We have what is called a 7-step local planning process, which takes place every year at the onset of the fiscal year, where there's a lot of discussions starting right from the ground level, what we call the ward level, and moving up to the municipality, where there's a lot of discussion. Especially now, there's a lot of discussion, and I would say fighting for resources in terms of allocating resources. As I mentioned to you before, the go-to is infrastructure, roads, buildings, right? Health is secondary. I mean, it's there, but it's not really there. But even if it's health, it's more of medicines, buying medicines, not really SPC. So in that context, we looked at the existing system, and we saw, as we kind of worked with our end users, was that the need to prepare, the need to look at the evidence in terms of both quantitative as well as the qualitative, because for behavior change, they need to have a deeper understanding of the audience. And also, so this whole phase, preparation phase that we've built into this prototype is built like 3 months before this advocacy phase, the 7-step planning process takes place, so that the health coordinators at the local level are able to plan, prepare, and when they need to advocate for these resources, they have what they need to advocate for that. And so they have a better chance of getting resources allocated for SPC. Then after that, the third phase is definitely once they have resource allocated, then they would plan and monitor that. So again, if SPC is understood, then they care, and I think the resources are put in. Next slide, please. So in terms of what are the lessons for family planning SPC from what we have done? Next slide, please. The first thing definitely is to have an enabling environment for SPC. So in Nepal, we have now, there's a reflection of SPC in the national health policy. The provinces, as I said, are new, but now as they are designing their policy, they are reflecting what is in the national health policy, and they have health promotion, behavior change built into their provincial policy as well. And in the municipalities we worked in, we also were able to work with them, and they're convinced to put in SPC into their local policy as well. And we are also working now, if we can do it, to see if we can spread that across different municipalities across Nepal. Very important for this to be there, because this provides the base for other work to be done. Very important to understand the bureaucratic process in terms of systems, how what time things work, how things are done, because the government, the local resource allocations, everything is set in a certain timeline. This priority is set, so we have to understand and at best use that in terms of moving forward. Once you're able to do that, I think it sets up a good environment for SPC being funded. Next slide, please. So very, very important, again, to get the local decision maker. So this is more of the elected representative and the executive who work in the local level, because the health personnel have some understanding of health issues, they have some understanding of social behavior change, but being able to get buy-in from the elected representative so that they prioritize SPC is very, very critical. And especially the executive committee members who have the authority to provide funding or cut funding, they have to understand how the issues affect the local constituents. And I think it's very important because the elected representatives are very tied to their local constituents, and once they understand how SPC can help them better understand their constituents and help them design programs based on the understanding, I think they're on board. What we found out is that they went above and beyond the work that we were doing with them as they went out to have a better understanding. Even now, they are going out doing like household surveys. They're going out doing more of a community interaction programs to understand the audience better. So getting local buy-in is very important, because they also balance the push with the health personnel to ask them about SPC and make it a priority. Okay, next please. And definitely emphasize evidence for SPC. There's a need for that, because generally the practice has been to get funding and quickly run off and design programs. For example, with the understanding of SPC being maybe IEC material, design some radio spots, design some posters and things like that. So being able to get them to step back and take a look at the evidence, look at the quantitative trends, then also, like I said before, to understand the audience, provides that the needed understanding that gets the funding allocated when there's a need to kind of fight for that resources. So just to get even asking for evidence now, I mean, even now the local level elected representatives are asking for evidence. If the health personnel ask for certain things, they have to provide evidence. So emphasizing evidence for SPC is very, very important, because then you have to be able to argue for the need for SPC, and you can only do that based on evidence. Next slide, please, my last slide. So again, talking about Jane, if they understand, I mean, we see that if they understand, they care, and if they care, then they'll definitely help and step in. And so this is local resources. This is not external resources. We were able to mobilize local resources at the local level in Nepal, and I think this can be done in other places as well. So with like little resources from across the 700 different palikas, I think the resources can be set. Okay, thank you.
Thank you, Pranav. We have just a few minutes for a couple of quick questions before we close out. And I see that Uttara did a nice job of responding to her questions in the chat box. So thanks for saving us that time. One sort of very, very pointed question for you, Michelle. Can you tell us a little bit about Breakthrough Research's plans for additional country case studies for the business case, and how are those selected and what data will you be using?
Yeah, so we're looking at probably selecting 2 countries in West Africa, which I think will align nicely with some of what we heard from Perry about the focus and the need for more SBC work and evidence in that area. And then we're going to be working closely with our colleagues at Breakthrough Action and other partners to sort of identify the best candidates of what those countries might be. And then that work is going to bring together all the evidence we've already synthesized as part of the business case process, and then bring in some more country-specific data from demographic health surveys, from their own plans and strategies and things like that, to make sure that it's really grounded in the country context in those 2 countries. So if people have suggestions, please put them in the chat box. We'll take note.
Thanks. I would also like to flag the fact that Breakthrough Research has developed some really excellent guidelines for collecting cost data for SBC programs. So for those of you who are SBC implementers, particularly in the field, I would encourage you to look at those guidelines, because I think the more programs are collecting cost data on a routine basis, the better equipped we will all be to make a compelling statement about the cost effectiveness of this type of programming. One final question, Sohail and Perry, for you, really for you, Perry. What do you see as some of the key challenges in getting SBC prioritized in Ouagadougou Partnership country implementation plans?
Great question. I think we're just at the beginning phases of really understanding. There's been advocacy around this, recognition in the national plans that it's the least funded component of the plans. And I think with the annual meeting this past year, you know, the work of Breakthrough Action and Breakthrough Research, the work of Track 20, work of other partners really elucidated it really made the case for all partners together to recognize this is what the data is telling us. This is pointing us toward really focusing in on SBC to do some, innovative financing work. Frankly, there's a lack of resources, and it tends to be an easier reaction or a more ready reaction for countries and donors to lean in on the more supply-oriented interventions. But achieving more of a balance is what I think we're all striving for. And there's just, frankly, limited resources. So, thinking through, are there other ways for us to maybe pool resources, make opportunities available for countries to opt into, create more of a demand-driven response to countries' appeals for resources and support in this area.
Okay, thank you. That is helpful and a very thought-provoking note on which to end the webinar. Again, I want to thank all of our presenters for sharing their work, and thank everyone who signed in to join us and asked great questions. Please do read through the shared agenda and think about how you can share it within your organization and how the work that you're already doing might be able to contribute to some of the recommendations on coordinated investment. As a reminder, a recording of this webinar will be posted on the Breakthrough Action website, along with the various resources that have been shared here today. We do hope you will be able to join us for the forthcoming webinars on other priorities. And you'll now see a brief survey appear on your screen. Please do take just a couple of minutes to fill it out, as it will help Breakthrough Action continue to refine their webinars moving forward. Thanks again, and I hope that everyone has a good day. Welcome back to this short week, and thanks for joining us.